Hey guys, Dr. Paul here. A lot of my patients often ask me questions about mouthwashes. Should you use them? When should you use them? Which one's the best? In this video, I'm going to answer those questions and much more. I would recommend watching the entire video, but just to put you out of your misery and give you the answer now, over-the-counter mouthwashes technically do help your gums and teeth, but you don't necessarily need them if you're already cleaning your teeth and your gums properly, and they can be causing more harm than good. I don't use one myself. I don't use any mouth rinse. Now, there are some cases where I do recommend them, but they are limited. So, watch on to find out why and how. So Mouthrinses claim to kill the bacteria that causes teeth and gum problems, as well as freshen your breath. To know if this claim is valid, we have to understand what makes a mouth clean or not. A non-clean mouth is basically where the gums and the teeth aren't healthy. Most of the time, this is caused by plaque collecting along the gum line or in between the teeth, and that plaque is leftover food that's not removed from brushing or flossing. The problem is the bacteria associated with that plaque eat that plaque as their food source, create acid as a byproduct, and that acid is directly responsible for tooth issues and gum problems. If there's no plaque there to start with, we have no issues. So the question is, does mouth rinse help with this? The science tells us the answer is yes, but I'm here to tell you, not really. The reason is that the mouth rinse often contains essential oils that can actually kill the bacteria inside of the plaque. Now this might sound good because, like I mentioned, these bacteria are associated with making your teeth and your gums bad. However, the mouth rinse isn't really addressing the main issue, which is the plaque in the first place. If there's no plaque around the teeth and the gums, then we have no problems, and we're going to talk about that in the next part of the video. So before we do, a few points to mention. The first is that there are so many bacteria in your mouth that although the mouth rinse is effective straight away against killing these bacteria, that only lasts for a couple of hours, and then their numbers increase again and they're back to where you were. So it's not long lasting. The other thing is that our mouth is filled with billions of bacteria that are in a very complex environment. And if you've got this non-selective mouth rinse coming in and killing some of those bacteria, you can upset that balance. That's not really something that you want to be doing. So I'm hearing some of you saying, well, Dr. Paul, what do I do then instead of using mouth rinse? Simply, just clean your teeth and gums effectively. This involves a few things. 1, brushing for 2 minutes twice a day. 2, remove the plaque by angling the toothbrush at 45 degrees towards the gum. That way you're cleaning the tooth and underneath the gum at the same time. I have a video that covers that in great detail. Number 3, cleaning in between your teeth, like with flossing, before your nighttime brush. I have another video on flossing, covers that in detail too. 4, after you finish cleaning, brush the top of your tongue to keep it free of bacteria. And number 5, go to the dentist, ideally twice a year, but at minimum once a year, so they can go around and clean everything, clean the gums, clean the teeth, make sure all of that hard buildup is removed. That way your gums and teeth will be very clean, very healthy. Now I wanted to touch on something for the patients that say they want to do this for fresh breath. I completely get that, makes sense. You do get that fresh breath feeling after you use mouth rinse. Instead, what I'd recommend is that after you finish brushing your teeth, before you spit out the toothpaste, get a little bit of water in a cup, put it in your mouth, and then use that for rinsing. You've already got that minty flavor from your toothpaste. Use that as the mouth rinse. Use that to get your breath feeling fresh, and then spit that out. That's even better. I mentioned before, in some cases, mouthwash can actually be bad, and there are a few reasons for that. First is when you brush your teeth, your toothpaste most likely contains fluoride. That fluoride is very important to keep your enamel strong and to stop your teeth getting holes in them. If you've brushed your teeth for the 2 minutes, put fluoride on, spit out the toothpaste, and then rinse your mouth with a mouthwash that doesn't contain fluoride, you've just got rid of all of that fluoride. And you're using something that isn't actually that effective. So it's actually put you in a worse position. So after you brush, just spit the toothpaste out, which leaves a little bit of that fluoride, and then leave it at that. Or if you want that fresh breath feeling, like I said, get a little bit of water, swish that around, and then spit it out. Second is that some mouthwashes actually contain alcohol, which is known to dry out your mouth. If that's the case, saliva can't play its role in stopping your teeth from getting holes in them. Hey, super quick, if you're getting something out of the video, please like, share, or subscribe. It really helps me out a lot. Alright, back to the video. Lastly, mouth rinses are very non-selective, which means that they're just going to kill all the bacteria, which can disturb that very complex balance that your bacteria are sitting in, and that's not always a good thing. So let's talk about when to use mouthwashes. For me, there's 3 specific cases, and there's specific mouth rinses to use for those. First is for patients with active gum disease. For these patients, they have specific bacteria that are causing the gum disease, and there are specific mouth rinses that target these bacteria. Now, the first step is good cleaning at home and at the dentist. But as an adjunct to help control it, mouth rinses are really, really effective. Now, the 2 main ones are ones that contain chlorhexidine and ones that contain hydrogen peroxide. The ones that contain chlorhexidine have been around for the longest, they've got the most research, and typically they're the most recommended. They're the ones that I recommend to my patients. In Australia, we have two main ones that contain chlorhexidine. One is Savicol, the other is Curacept. They both do the same thing, but Savicol will actually stain your teeth with 2 weeks of consistent use, whereas Curacept won't. The only downside to Curacept is that it is more expensive. Now, one thing to note is that chlorhexadine's effect is actually inhibited by the toothpaste that you use. So what that means is it's very important to not use that within 1 hour of brushing. So at least 1 hour before or 1 hour after brushing your teeth is when you use that mouth rinse. So a little bit in a cup, swish it around for about a minute and then spit it out. But like I said, 1 hour before or after brushing. The next case is for patients with gum pain associated with wisdom teeth. What's happening in those situations is you have your wisdom teeth with a flap of gum over the top and food or plaque gets stuck underneath. That food or plaque provides food for the bacteria in underneath the gum, and because they're so protected, their numbers increase, the body responds by inflammation and infection, and it becomes really sore. So the bacteria that are actually in underneath the gum, they're bacteria that don't like oxygen. So the mouth rinse that we use is one that actually causes more oxygen to go to the area. It's this guy here, it's Peroxyl. It contains hydrogen peroxide. That peroxide has a big foaming action when you swish it around, with the oxygenated bubbles going in underneath the gum and killing those bacteria. I also recommend often for patients to use a little syringe to actually get it in underneath the gum to make sure that it's actually being the most effective. The other thing, of course, as well, is getting your toothbrush back there in under the gum to get rid of that plaque and disturb the area quite a bit. The last case that I recommend it for are patients that have lots of holes in their teeth. These patients need more fluoride on their teeth during the day to help reduce the chance of them getting more holes. The mouthwash for that case is this guy, it's Nutriflor 220. I don't recommend using it after you brush because like we said before, when you brush your teeth, you're already putting that fluoride on there. So instead, don't rinse after brushing, but do it during the middle of the day. So just after lunch or afternoon tea, for about a minute, rinse with that fluoride mouth rinse. That's another fluoride hit for your enamel, which is really, really good. So quite a bit of information, so I'll just summarize it for you. So mouth rinses, technically they are effective. They do kill some of the bacteria that cause gum disease and teeth problems, but they're not necessary if you're cleaning your teeth effectively, which means brushing twice a day, flossing before your nighttime brush, cleaning effectively by angling the toothbrush at 45 degrees to get in underneath the gum, and seeing the dentist ideally twice per year. In some cases, mouth rinse can actually be bad. For example, you're actually removing the fluoride that you've just put on your teeth after brushing. Some mouth rinses can dry out your mouth, which means less saliva, which means possibly more holes in your teeth. And also it can disturb the complex bacteria that are actually in your mouth. We don't really want that. However, there are some cases when to use it. For example, patients that have active gum disease, it's a good adjunct to good cleaning. 2, for patients with wisdom teeth pain, hydrogen peroxide mouth rinses can kill the bacteria that are associated with that pain. Or 3, for patients that have lots of holes in their teeth, getting more fluoride with a fluoride mouth rinse at some stage during the day can help stop the holes. So anyway guys, thanks so much for watching. I hope you got something out of the video. If you learned something about mouthwashes and you found it interesting or helpful, please like, share, subscribe. Those things help me out a lot. If you have any questions, put them in the comment section. I'll make sure to get to them. Thanks again for watching. Have a great day and keep on smiling.